Hello ladies, this is Dr. Lyra Bushra, your aesthetic gynecologist at Clinic21. Many women experience intimate health issues that can affect their comfort and confidence. Sadly, most of these women do not know that they have safe and effective non-surgical treatment options that they can avail. Today, we are going to talk about laser vaginal rejuvenation with Lyra Diode Laser. So this is the Lyra Diode Laser machine. So we are using a laser with 1470 nanometer wavelength that is effectively used for non-surgical laser vaginal rejuvenation. So it uses this special wand, and when I turn on the machine, you can see when I turn on the machine, it emits a light. It is the laser light that is emitted through the probe, and this probe is inserted through the patient's vaginal canal, and the laser is emitted throughout the vaginal surface as I withdraw the probe. So what the laser does is basically it produces heat energy that causes increased fibroblast stimulation. And these fibroblast cells basically increase the production of collagen fibers and elastin fibers. Therefore, the increased level of collagen and elastic fiber now makes the vaginal mucosa more elastic, thicker and firmer. Also, it increases the blood supply, which helps in the treatment of vaginal dryness, lubrication, and reduced sensation. So we have a patient here, a young lady, who has given us the consent to shoot a video with her. Obviously, we are not going to show her, but she has accepted, and we are performing Lyra laser on her today. She came with the complaints of vaginal dryness and reduced sensation for the last 2 years. So let's see how it goes for her. So you see, I'm applying the laser into the patient's vaginal canal. What kind of patients usually come to us? Usually, patients who are in their perimenopausal and menopausal age group, who are experiencing a decreased estrogen level in their blood, they often suffer from a thin vaginal wall caused by reduced estrogen. We call it vaginal atrophy. So these patients often suffer from vaginal dryness, irritation, and even bleeding on slight friction. And it's very uncomfortable for them, and they often complain about repeated UTIs. So Lyra basically helps this group of women who are in the perimenopause and menopausal age group. Then there is another age group who have become new mothers, and they're in their postpartum period and just has healed from their postpartum. So these patients, they often complain of slight stress urinary incontinence on coughing, sneezing, or while even talking loud or doing exercise. So what happens is, due to the prolonged pregnancy period and repeated childbirth, often the pelvic floor muscles become weak and their support system is weakened. And whenever there is an increased abdominal pressure, they tend to leak some urine. These women can be helped with Lyra, along with our Emsala chair, of course. So these two treatment options in combination really help this group of women by strengthening the support system. When the support system, that is the pelvic fascia and the muscles, are strengthened and the vaginal tissues are remodeled with the Lyra laser, it is of great help for this patient. So the Lyra laser works wonderfully for patients with vaginal laxity, stress urinary incontinence, and vaginal dryness. So one of the most common questions that patients ask me is whether the Lyra procedure is painful or not. So it is basically a painless procedure. You might feel a slight discomfort and a bit of tingling and warmth inside, but it is more or less a painless procedure. So another question that I get asked is, how long does recovery take? So initially, after the procedure, immediately the recovery is very smooth. It takes only about 3 to 5 days for the internal tissues to heal. You can experience mild discharge, like a clear discharge or a light pinkish discharge for a few days, and you are good to go in about 3 to 5 days. But sexual abstinence is advised for the next 3 to 5 days. A lot of my patients ask when they can return to work. Usually it is an office procedure and you can come during your lunch break and take the treatment and then go immediately back to your work. But for heavier weightlifting and swimming, it's advised you can wait for 3 to 5 days. So who may benefit? In my opinion, all patients are different, and when you come to us for a consultation, we first determine the reason behind your discomfort or the cause of your problem, and then according to your problem, we advise a treatment protocol for you. Therefore, ladies, please do not get misinformed. Come to the right place and take advice from your proper specialists. At Clinic21, we focus on providing evidence-based personalized care. We have the world's leading expertise, including Professor Dr. Shamin, and I myself, Dr. Bushra, as an aesthetic gynecologist, would be there to help you along with our leading specialists. Remember, your intimate health is a very important part of your overall well-being. So ladies, prioritize yourself and seek treatment when it's needed.